Delayed intractable post-extubation laryngeal edema after general anesthesia. Authored by Ji-yeon Kim, MD, PhD. Inya University Ilsan Paik Hospital, Korea. Post-extubation laryngeal edema. Tracheal intubation always has a risk of laryngotracheal injury and the possibility of laryngeal edema due to laryngotracheal injury. Post-extubation laryngeal edema, PLE, which could take place immediately after an extubation, makes airway management difficult. The percentage of PLE occurrence is about 2 to 22%. PLE mainly occurs within 30 minutes after extubation regardless of the severity of symptoms. 47% of PLE cases occur within 5 minutes. 3. Case: 78-year-old female patient who underwent uneventful operation. The patient had underwent tracheostomy 30 years ago. After 14 hours extubation, she developed PLE and the SaO2 was decreased to 88%. Reintubation was done, and she was transferred to the ICU. To reduce the airway edema, methylprednisolone sodium succinate was intravenous injected. A negative result was found in the cuff leak test 36 hours after the intubation, thus, extubation was performed. However, a second intubation was performed because respiratory distress and decreased SaO2 was observed 48 hours after the first extubation. Even though we used the steroid. A neck CT performed after the intubation showed laryngeal edema. On the 5th day after the reintubation, extubation was performed. However, 2 days later, respiratory distress and decreased SaO2 occurred again. But tracheostomy was decided instead of intubation. Because steroid administration was difficult to maintain further due to the pneumonia and inflammation at the operated region. Conclusion: although a careful observation during the first hour after extubation is important in a patient who may develop PLE13, as in this case, it should be recognized that PLE could take place even some time after extubation and even after the patient has undergone intensive care.